Welcome, everyone, to the International College of Integrative Medicine podcast, translating science to clinical practice since 1983. I'm your host, Luke W. Russell, and today I am joined by Dr. David Brownstein. Dr. Brownstein, thank you for taking time to sit down and talk with me.
Thank you for having me.
So could you just give us a little bit of background on you and your practice?
So I am the medical director for the Center for Holistic Medicine in West Bloomfield, Michigan. I've been practicing holistic medicine for just over 25 years. And I started off as a conventional doctor and not believing any of the stuff I'm doing right now, but I'm glad I took the turn into holistic medicine. It's really fulfilling and a wonderful way to practice medicine.
So what inspired the change in direction?
My big change came when my father was really ill with heart disease. My dad had his first heart attack at age 40, a second heart attack at 42, and over the next 20 years, gradually declined into congestive heart failure. And when I finished my medical school and residency training, which was conventionally based, and I didn't really have any holistic leanings towards then, he looked like he was dying, and he had continual angina for over 25 years. And so I was in a busy family practice office doing regular medicine, exactly what I was taught.
Yeah.
And I just started to feel uneasy about it and lose some sleep, and anxiety came. And, I remember talking to my wife about it and saying to her, I can't do this for the next 25, 30 years. And she said, "What's wrong?" And I said, "It's just I'm not helping anybody.
Wow.
All I'm doing is giving them drugs to treat their symptoms and giving them more drugs to treat the side effects from the first drugs." And I said, "I can't do this." And she said, "What are you going to do?" And I'm like, "I don't know." So around that time, a patient gave me a book, a holistic book, Healing with Nutrition by Jonathan Wright, who's an allopathic physician. And I took the book home and I opened it to cardiovascular disease because I was worried about my dad. And I tried two things on him, which were natural hormones. And within 7 days, his 25-year history of angina went away.
Oh, my goodness.
Within 30 days, his cholesterol in the 300s fell below 200 without changing any bad habits. He looked better, acted better, and once I saw the changes in my dad, I knew that's what I wanted to do in medicine.
Yeah.
And I did a 180 and walked away from the practice I was at and started doing it.
Wow. So what kind, one of the things I love so much about all the integrative and holistic physicians is how much you innovate, how much you are trying to figure out what's really going to work for your patients. What kinds of things lately have you been working with your patients and kind of discovering new possibilities for their health?
Well, since seeing the changes in my dad, which was two bioidentical natural hormones, was natural testosterone, natural thyroid hormone, every patient since then gets a whole hormonal workup. And so I consider that the basics, balancing the hormonal system. I work with patients with balancing their nutritional system and correcting nutritional deficiencies, detoxing heavy metal toxicities, rampant, and, eating better.
Yeah.
And really I consider that just doing the basics, and, then you can add on to that, but first start with the basics.
Yeah.
I've been preaching, my book writing and my newsletter writing for, 25 years.
Yeah. What do you feel has been particularly intriguing in your application of bioidentical hormones?
Well, you see the changes in your father, who looks like he's going to die at any moment, to, angina gone, his pale pasty color turning pink again, and shortness of breath gone. That's all I needed to see. And, I've had similar results with other patients, and it's, I feel like I'm doing something right for the patients. I'm treating their underlying cause of their problems instead of just their symptoms and masking it with drugs.
Yeah. Can you think of a story with one of your patients that was maybe a particularly harder case to really get their health back on track, and kind of how you work through that?
Well, there's lots of patients, but, sometimes you end up going down the wrong pathway, or they're not getting better even though they should get better, and you're correcting what's you find on the lab tests and they don't improve. And then, I always tell the patients, I always thank them for staying with me if things aren't going the right way. And I tell them I wouldn't give up. I would just keep plugging away. And eventually, if you help the body, you give the body enough room, it usually can take care of itself, even if you don't fix everything.
Yeah.
And that's been my experience with it.
Do you think, as a physician, because it like, are you pretty? Do you think like it's normal for a physician to be pretty hard on themselves? I'm talking within this integrative world when you're like not figuring it out, and
Let me tell you, there's no bigger critic on me than myself.
yeah,
And I have two children in medical school right now,
wow,
and I've made it clear to them, medicine is a pain in the butt. It's a lot of work. The work never ends, and it's a lot more work than most other professions. And you shouldn't go into it for the money, because you'll be disappointed for that. Not that the money, I'm not complaining
Yeah.
about anything with the money, but I think there's easier ways to make money. But the rewards are there, and I would do it again in a heartbeat.
Yeah.
I really like it, and it's worth it. It's worth the work. And I wouldn't call it commiserating with my doctors, but I talk to my friends, and
Yeah.
we all know what it takes, and especially when you branch out in the alternative world, because you get shunned from your conventional friends, and you have to get a new group of friends to support you because those other ones just don't.
I'll be back in a little bit with more from Dr. David Brownstein. In the meantime, let's listen in to what ISOM's Executive Director, Wendy Chappell, has to say.
Hello, everyone, and thank you, Luke. I want to start by reading our mission statement from our website, icimed.com. The International College of Integrative Medicine is a community of dedicated physicians who advance innovative therapies in integrative medicine by conducting educational conferences, supporting research, and cooperating with other scientific organizations while always promoting the highest standards of practice. Now that sounds very nice, and it is really what we do, line by line. It's how we spend our time and our budget. But I think the most important thing to know about ISOM is that when people are part of ICIM, they connect with each other in a very special way. They are able to find like-minded healers who can speak their language and who share their obsessive love of science. I call it obsessive because it seems like all you guys want to do is learn. And they support each other emotionally in a scene that can be quite isolating for a lot of our docs. It's great to be in a group of people who enjoys the same kind of success in a field that is not always given credit for their success. Come join us. Check it out. icimed.com.
Now, back to my interview with Dr. David Brownstein.
So, how would you say you've transformed as a physician over the last 5, 10, 15 years?
Well, every time, how have I transformed? Every time I start to feel comfortable and I think I know what I'm doing, you get thrown a curveball. And someone doesn't respond like you expect them to respond. So you just got to keep working at it. How have I responded? I've learned to, over the years, I've learned to listen to my patients better. And I've always been a good listener, but when I look back on things, usually I'm not listening enough to what they're telling me to help them find, what's wrong. And they'll usually tell you, maybe in a roundabout way, but they'll tell you, and, you just got to keep plugging away at it. It's, sometimes it's a slog in the mud. And,
Yeah.
I'm willing to go down there with them if they'll go down there.
Yeah. Looking out at the medical landscape with organizations like ICIM trying to really help keep pushing all this forward. Of course, there are lots of forces trying to push against. When you look out ahead into the future, what do you see? Do you see hope for patients? Do you see hope for the industry?
Well, luckily we have organizations like ICIM because, you as an alternative doctor, you can be out there and you lose a lot of your previous support system. And do I see hope out there? Yeah, there's hope out there. And I think the hope out there comes from the internet, and which is good and bad to it, but it allows patients to search for help them find their way through this mud
Yeah.
and muck. And I think that'll be the differentiating thing, because there's a lot of misinformation about alternative medicine.
Yeah.
And there's a lot of misinformation about conventional medicine. And the drugs aren't how they're often portrayed to be. And the patients are searching for this stuff, and they'll find it. And as they become more knowledgeable, they'll make better choices on their health care. I like my patients to be knowledgeable.
Yeah.
I've written 15 books.
Wow.
I've written them for both patients and doctors, and I want my patients educated on what I'm doing, and I want them to make the decisions on where they think their health care should go.
So, what would you love either med students or physicians fresh off their residency? What would you love them to hear and know?
Well, I'd like the young doctors to look into the research on a lot of what's accepted as standard of care in medicine, and really critically look at it, and critically look at those drug therapies and see if it makes sense. Because a lot of times the numbers don't make sense. And I teach medical students and doctors how to read studies, how to go through statistical analyses of studies, and how to use that going forward with things. So what do I want? I want them to keep an open mind. I always tell the medical students and residents when they rotate with me at the end, I hope you'll find what I'm doing useful and you'll do some of it. But if you don't beat up your patients when they come up with an idea you know nothing about. Be okay to say, I don't know. Let me research it. And if they're not going to hurt themselves, you don't have to tear them down about doing something that's a little bit alternative.
Yeah.
You don't have to tear them down anyways. But if you don't know, it's okay to say, I don't know.
Yeah. Yeah. What? So since you've spent a lot of time working to put your ideas down on paper, what? Kind of two questions. It might be the same answer. One, is there one book for physicians who would be listening to get a better understanding of bioidentical hormones? Is there a particular one of your books you've written that you would say? Because I know one of the things that's cool about ICIM is, the doctors come and everyone's learning from each other. So what would you say is like, hey, you know what? If there's one, the first place to start, this would be this.
Well, after treating my dad, every person got a whole hormonal workup.
Yeah.
And I was using a lot of bioidentical hormones from that point on 25 years ago, and I'm still using them today.
Yeah.
So what do I tell? I tell young medical students and physicians and residents, they want to get into this, do what I did. Start with the bioidentical hormones first and then just build on it. And my first book was Miracle of Natural Hormones. I wrote it in 1998. It's a couple editions past that now.
Yeah.
But it's still apropos today. I still use exactly what's in every one of my books.
That's awesome.
I've recently gone through all my books to see if I would do anything different. There's nothing I would do different. They're all about what works and what I see in my practice.
Yeah. What would you say to the physician the younger physician or resident that just feels a little nervous about implementing alternative practices?
Well, I had this discussion at dinner with a doctor last night, and he heard my talk on iodine, and he said, I just can't seem to do it, and I get nervous about it. And he goes, what do you think I should do? I said, I think you should read more, and I think you should let your brain decide what therapy seems right and do it. I said, if you're doing a therapy you don't think is right, then I don't think you're doing your patients any good. And for me, that's when I was losing sleep 25 plus years ago, and I just couldn't do it.
Yeah.
I can sleep pretty well. Well, maybe I don't sleep well, but that's not from that. But I can sleep fine now. I don't have to worry about that stuff.
Yeah. As an ICIM member, can you talk a little bit about how the organization has influenced your career?
So I've been to many other organizations. I've lectured to them. Everyone has good and bad and positives and negatives, but ICIM is really a special organization where there's no hiding back of information. Everyone's sharing, everyone's open, and it's got a different feel than most other organizations out there. It's just got a family feel to it.
Yeah.
I'm very happy here. I can't see changing anything, and I think it's a great place to be involved with.
Can you think of and maybe this isn't the right question, but can you think of a time where being part of the ICIM community, maybe you reached out to one of your fellow physicians, and it really helped you with whatever you were trying to.
Oh, absolutely. So John Trowbridge is a good friend of mine, which I know you interviewed, and him and I were talking about stem cells, and we were frustrated with it, and a couple meetings we were talking about it, and then he calls me and says, "Hey, I found a company I think you're going to like because I like it. Talk to me about it." And him and I have started talking about it more, and just stuff like that. It's just I learn. I guess I would say I learn the most at my lunch breaks or
Yeah.
coffee breaks or when
Yeah.
I'm just talking to my friends and saying, "Hey, what are you doing?" or "What's working in your practice?" Because I know if it works in their practice, it'll work in mine.
Yeah. On the stem cell piece, have you started using that company Dr. Trowbridge recommended, and have you?
Yeah.
Have you seen a difference in results from what your previous experience was?
Well, I didn't use them before because I couldn't
it.
find a company I trusted.
Yeah.
And so when John said to me, I trust this company, I didn't need much more than that. There's a
Yeah.
few people that when they tell me that, I'll do some research, but I'm willing to take their
Yeah.
recommendations, and we've been talking about it since then, and it's stuff like that. It's
Yeah.
we help each other out.
Yeah, that's awesome. Well, thank you so much, Dr. Brownstein. I really appreciate your time.
Thank you for having me.